I just got a phone call that I need to head over to the ER. There's a patient, a full trauma that has possible spinal cord injuries, and that I'll need to manually ventilate Mrs. Smith. So the ED has Ambu bags in there. I'm going to go ahead and grab some oral pharyngeal airways. While I go, or on my way, come into the room. Kate with respiratory, introduce myself. Patient is not responsive, but I introduce myself now to the staff, the staff in there, and to the patient. I went ahead and just washed my hands, put on some gloves, and I have my oral pharyngeal airways in my hand. I'll go ahead and look at Mrs. Smith and see, just measure real quick what kind I want to use. We'll go ahead and use 10 centimeter oral pharyngeal airway. Because she is a full trauma, she does have possible spinal cord injuries. So I'm just going to do a 2-finger chin tilt, try to get that, displace that tongue out of the way, and I'll insert this Goodell oral pharyngeal airway halfway, and then 180-degree twist. The flange is going to go ahead and sit right on her mouth there, and then on her lips, and now I have a secured airway to administer oxygen to, or administer breast to Mrs. Smith. So I have my bag is hooked up to oxygen tank here, and I'm going to be very careful as to not to jerk the patient, keeping that 2-finger head tilt. I'm going to go ahead and start administering breaths. What I'm looking for is if Mrs. Smith is having any chest rises. I do need a tight seal around. And I'm going to administer breaths 12 to 20 breaths per minute. I'll wait further instruction to see if she's going to the operating room, if we're going to intubate the patient. And but the best position I could be is at the head of the bed here, administering breaths to Mrs. Smith.